So my name is Dimitris Bourikas, the full name. I come from Greece. I'm a PhD in neurosciences. I have spent quite a number of years in research and development, mainly in the field of multiple sclerosis. And 11 years back, I have joined UCB in the medical affairs function and started from a local MSL role and gradually moved to more regional medical management role, to the European medical lead, and currently I'm the global medical lead for 3 of our main assets, which is Briviact, Vimpat, and Keppra. The abstract comes out of the interim data of non-interventional prospective study that has been performed in many European markets as well as in Canada. And the purpose of the study was to assess the Briviact outcomes when used in early treatment lines. So the data that we have collected from our randomized control trials and the prospective and retrospective studies that have been published so far, usually they refer to patients that have used a number of other antiseizure medication in the past, and then Briviact was added. The purpose of the Brivaracetam study is to assess the tolerability, the effectiveness, as well as patient-reported outcomes when Briviact is used in earlier treatment lines in patients that have received up to 3 antiseizure medication throughout their lifetime. Now, being non-interventional prospective study, it means that the patients that are being recruited in the study are representing the daily clinical practice. There is no exclusion criteria. It's real-world data that this study is actually producing. And the main outcome of the study is, of course, both effectiveness and tolerability. And this was presented in one poster during the AS, while the second poster that Peter, you have picked up actually refers more in the patient-reported outcomes. Now, both, of course, are of equal importance. Traditional, we are looking in the effectiveness of a given asset, as well as the tolerability. But it becomes more and more apparent that looking into the effectiveness and tolerability is not enough. We need to go a step further and to see actually what's the impact of any given treatment in the daily life of the patients. And that's why we actually ask the patients themselves to provide us with their patient-reported outcomes and to be able to assess a number of parameters of their daily life. So the findings, sorry, this was a bit of the introduction. So the findings in terms of effectiveness. So we have seen that more than half of the patients, around 51% of those patients that have managed to reach the 12-month observation period, they managed to remain seizure-free for a period long, at least 6 months. We have 73% of the patients that have reported to be 50% responder rates from the baseline to the last assessment. And this reflects the effectiveness outcomes. In terms of tolerability, we have seen that around 9% of the patients reporting drug-related adverse events, and close to half of those, close to 4.8%, actually discontinued the study due to tolerability concerns. So all in all, this data actually show that Briviact, under the daily clinical practice conditions and when used in the early treatment lines, is actually it's an effective anti-seizure medication and very well tolerated. Now, as I said, the other part of the study looked at the patient-reported outcomes, and there we have assessed a number of outcomes related to the overall quality of life, to depression, to cognitive impact following seizures, to seizure severity, or we went as far as assessing the impairment in productivity. And we have seen that in all the measures that and all the patient-reported outcomes that we have assessed, Briviact has provided to improve actually all of them. And to highlight a few numbers, if you wish. So we have seen, for example, that we have a numerically threefold reduction in the overall work impairment, which means that there was the time that there was productivity impairment was reduced to 1/3 when Briviact was introduced to the treatment algorithm. We have seen that we have an approximate 60% reduction on the seizure severity. So traditionally, we count the seizure numbers and the seizure frequency, but it's of equal importance to also measure the seizure severity. And we have an approximately 40% reduction of the patient population that have reporting cognitive side effects following a given seizure. So all in all, it's not that we managed to have very good effectiveness and tolerability following the introduction of Briviact in the treatment algorithm of these patients, but we have managed also to improve their daily life, and I have mentioned some of the parameters where the major improvements have been observed. So for frontline practitioners, I would say that if I can summarize in a key message is that the earlier Briviact is used in the treatment algorithm, the better the outcomes will be, not only in terms of effectiveness and tolerability, but also in terms of improving the daily life of the patients. I think I have summarized everything in this short sentence. What I need to highlight is that traditionally in our studies, we have been talking about effectiveness. We have been very strongly talking about seizure reduction. We have, of course, been touching upon the safety and tolerability, but it's of equal importance to also assessing how the patients feel through the patient-reported outcomes, because at the end of the day, it's not the seizures that play the key role. At the end of the day, what we are all trying to do is to improve their lives. And to improve their lives, we need to ask them, and we need to see that their daily life, their work, their mood, their cognition remains as much as we can intact. And this is what eventually is improving their daily life and their quality of life.